Good evening, everyone. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us tonight for a great discussion all about weight loss surgical options. Ask your questions. We would absolutely love to have you ask questions. I am joined with Dr. Pavlos Papasavas, who's co-director of bariatric surgery here at Hartford Hospital. Thank you so much for joining us tonight.
Thank you for having me.
Yeah, this is always a popular topic in weight loss, and everybody at one point or another wants to try and lose weight, and there's diets out there, and there's so much out there, and sometimes it's hard. So I just want to first sort of give us an overview of the weight loss program here at Hartford Healthcare.
So let's start by stating that obesity is a chronic disease.
Yeah.
And we have to acknowledge that.
Mm-hmm.
And there is no cure for it.
Mm-hmm.
And this is why people struggle for years.
Mm-hmm.
So you start with adopting a healthy lifestyle and a healthy diet. So we start with educating patients as to what is a healthy diet, what is not a healthy diet, and trying to modify their choices. We ask them to keep a food diary, and we would like to see change. That's the first step. Then the next step up would be trying a medication. There are several medications that are used for weight loss with various responses. And the next step up would be either endoscopic treatments or surgeries, like the sleeve gastrectomy and the gastric bypass.
And I think it's important to talk about when you, talk about options and people coming forward and talking about weight loss as a disease. I think that once people recognize that weight loss is actually a disease, maybe then we could reduce some of the stigma that surrounds what society views of overweight people, is understanding that this is a disease. It's not anybody's fault.
Absolutely. There is very good science now that proves that when a person goes, let's say, to a very low caloric diet, this person will start losing weight and their body will fight them. When you go to a very low caloric diet, your hunger will increase and your metabolic rate will slow down. So your body is trying to bring you back to the starting point. It's a theory of the weight set point that is set at a higher level. So your body sabotages your effort to lose weight.
Right.
So it's very simplistic to say, go out, exercise, follow a healthy diet, and you'll be fine.
Right.
The majority of my patients have tried this for years.
Right.
They lose the weight and they gain it back. So it is a chronic disease. It's very complicated. Everybody's obesity is different with different mechanisms.
So is that why it's harder or easy for some to gain weight, harder for others to lose it? Is that where the difference is?
Yes.
Yeah.
There is. I wish there was like a magic pill or a magic treatment that we can cure this chronic disease.
Right.
There isn't.
Right.
It amazes me because sometimes after surgery, some people don't follow any instructions, but they have excellent results. And there are people who follow every instruction and they struggle with weight regain sometimes. Surgery is very effective. Bariatric surgery is very effective, but it's not a cure. There is a weight regain in some people over time, which is kind of normal because with aging, we all gain a little bit of weight and it's harder to lose weight, unfortunately. But we're trying to maximize the success of bariatric surgery. And what can you do to maximize it? Is do more research, like explain the variation,
Right.
and try to address it,
Right.
but also adopting a healthy diet.
And having that follow through long after bariatric surgery, weight loss surgery, is, I think, so critical. It's not just, okay, you've had weight loss surgery, go on, good luck. And the program at Hartford Healthcare it's multifaceted. You have so many team members that even after surgery, you're following them through to ensure that there is success after weight loss surgery, because it's more than just the surgery.
Absolutely. Like any other chronic disease, it needs chronic follow-up,
Right.
right? If you have cancer, you don't say goodbye. You have to have follow-up every year, every 6 months initially, every year. So the same with weight loss surgery. We would like to follow up our patients for life.
Right.
Unfortunately, we lose a lot of our patients through follow-up. We're trying to re-engage them. We have a multidisciplinary team with psychologists, with nutritionists. We have physical therapy experts for patients with mobility issues. We have an obesity medicine team in our program that helps with pharmacotherapy. And whenever we have to do revisional surgery, we can do that. But it's a multifaceted approach to this. We're also exploring new technologies that will help us engage our patients more and bring them back to our program for better follow-up.
In case you're just joining us, we are talking to Dr. Pavlos Papasavas. He's co-director of bariatric surgery here at Hartford Hospital. We encourage you to ask him questions while we have him here for a few minutes. Anything about weight loss, about surgery, if you've had it, if you want to comment, we invite you to join the discussion. I want to talk about, really weight loss surgery has come a long way. Many years ago, it was very invasive, and now there are less invasive techniques, shorter operating times and quicker recovery for patients out there. Talk to us a little bit about how it has changed and evolved over the last, say, 10 years even.
Yes, absolutely. When I was in training, most of bariatric surgery was done in open fashion with a big open incision, and the morbidity of this approach was high in patients with a high BMI. So what was a revolution to our field was the minimally invasive approach. We can do these surgeries with 5 tiny incisions. So the recovery is much, much better with less morbidity. So the number of cases increased. It's more than 200,000 cases per year in the U.S., but also the way the quality control of these cases has increased. So now the centers of excellence, any case you perform has to be submitted to a national database, and every center is held accountable on quality outcomes. So it's a very regimented discipline of surgery. That's why the outcomes are so good.
Yeah, certainly a lot better than, say, 10 years ago, right?
20 years ago.
20 years ago? Yeah. Where do you see weight loss surgery going in the future in terms of technology? We see technology playing such a vital role in so many disciplines, and weight loss is one of them.
So there's a lot of effort in coming up with technologies and solutions for obesity that is less invasive. Medications are getting better. There will be some new medications coming out that will promise weight loss close to the weight loss that you get with sleeve gastrectomy.
Yeah, and that's what I want to ask you about, the so-called magic pill. But no magic pill, I get that. But there was a study done recently about, it is not FDA approved yet, but tell us about that. And it is about taking a pill to expand your stomach.
No, there are like 3 pills you take with your lunch and your dinner. These pills, when they go down to your stomach, they expand. So they give you a feeling of satiety and fullness, which leads to less food consumption.
Right.
And it's not FDA approved, but this is another way of less invasive management of obesity.
Yeah.
So also endoscopic treatments. There is the intragastric balloon that is not approved by the insurance, but is FDA approved. And maybe new surgical technologies and techniques down the road. I don't think surgery will go away because it's very, very effective.
Absolutely, yeah.
But I think we can do a better job in prescribing the right treatment for the right person. If we can predict who's going to do well with the medication versus surgery. And personalize the care that we provide.
And speaking of research, you're involved in research happening right here at Hartford Hospital with the Institute of Living and really precision medicine in terms of using fMRI and using MRI tactics to kind of hone in on, triggers and what people are thinking when they see certain images. I find this very fascinating. So explain to our viewers a little bit about the ongoing research that you're involved in here.
We have a grant by NIH, and the team is Dr. Godfrey Pilson from IOL, my partner Dr. Tischler, Michael Stevens from IOL. So we're looking at the MRI of the brain. It's called functional MRI. So the person is in the MRI machine. We're looking live at their brain, and we do several tasks. One of them is showing them pictures of healthy food and unhealthy food, and we see how the brain reacts. We also do what is called regulation of craving. So we show you a picture, we tell you, think of this food as if you want to eat it right now.
Right.
Then look at this picture and think of the consequences of eating this food. How can you control your cravings? So with these MRIs, we're trying to predict outcomes. Ultimately, we would like to get people on the machine and train the brain.
Right.
Make the executive areas of the brain
sort of
more powerful.
Retrain
the brain.
Yeah.
So we can control the urges that we have to consume high-caloric foods.
It's interesting now. And just speaking for myself, if I'm really hungry and I see a piece of pie or something, I'm like, I want to eat that right now because I'm really hungry. But if I'm full, I'm like, oh, I just can't look at that pie, or I can't look at another thing. Does that make a difference when you're full versus when you're hungry, how your brain is reacting to visualizing certain foods?
Another part of your brain, though, tells you, don't eat this pie because it's not healthy, right?
Right.
But
right.
which part will win the battle?
Right. It's a constant battle going
exactly.
on. Yeah.
The part that says, I want this food, it tastes good, it smells good, it's right in front of me. Or
Right.
the other part that says, don't eat this food, it's not healthy. You know you're going to pay the price.
Right.
So it's hard. Obviously, if you have a feeling of satiety, that helps. But sometimes we override these signals. Like, how can you eat more than you should eat, right?
Right.
We get the signals for our stomach, tells you, you had enough food, but sometimes we don't listen to these signals, so you continue eating.
Right, right.
Yeah.
It is a constant battle. So that's why I think this research is so fascinating, because you're retraining the brain. What have you learned so far in your studies? Is it too preliminary right now? Where does the study stand in terms of data?
Right, so we had a preliminary study a few years back, which we used to obtain the grant, and based on this study,
That was a smaller group of people,
was 65
right? Yeah.
patients, and based on this study, we did predict a lot of the variation after bariatric surgery. It's interesting because we gave the best testing about eating habits, about binge eating, about depression, mental health. Nothing could predict weight loss better than the MRI.
Wow, interesting.
So there's a lot of hope in this field.
Yeah, and in terms of outcomes and successful outcomes, getting to sort of the root of it, which really is the brain in controlling urges, or learning how to deal with those urges, I think that's really getting to the core of it.
I think it's one big aspect
Yeah.
of this. There are other, though. There's also genetic.
Right.
There is the microbiome, or the bacteria we carry in our gut, and how they interact with food. So we actually did a study with Jackson Lab looking at the microbiomic profile of our patients. The results will come out hopefully soon. So we're trying to explain the variation and the outcomes, looking at many, many aspects, not just the brain.
Yeah,
but
and that's one large aspect, as you mentioned. People who are like genetically predisposed of gaining weight, if weight is an issue, how do you approach that? How do you deal with patients who where weight gain runs in the family?
So right now, there's no any treatment specific to people who have a genetic predisposition. But we follow the same approach like any other person, with knowing that if somebody has many family members who have obesity, they have a higher risk of developing obesity, obviously. But there's no any active treatment for genetic manipulation to treat obesity.
And going back to what you said earlier in the beginning in terms of weight loss being a disease, it leads to other diseases too that develop with diabetes, that can lead to potential heart attack, stroke. It can lead to so many others, and I think that's where it has to be taken so seriously, that it's not just a weight issue, that I'm not just obese. It's so much more than that. And with weight loss surgery, you see almost immediately people who, I'm sure you've seen patients come in with diabetes and having these comorbidities just, almost virtually go away after. Is that right?
It is true, especially for the gastric bypass,
Yeah.
which is a very metabolic surgery, and it has an almost immediate effect on diabetes. And this observation led to a lot of research to understand how these surgeries work, because it's not the weight loss, like you said. Within
Yeah.
days
Right.
after surgery, you see the metabolic effect.
Yeah.
The blood sugars get better, the insulin resistance goes down,
Right.
the body becomes more efficient in dealing with blood sugar. So it's true, and that's why we call it metabolic surgery.
Right.
And diabetes is the one disease that has the closest link with obesity. So a little bit of weight gain increases the risk of diabetes. What the public doesn't know is that the best time to intervene is when you have pre-diabetes or early diabetes. This is when we need the patients to come to us for intervention. If you wait for 10, 15 years and your diabetes is so severe that you take a lot of insulin, a lot of medications, the chance of remission is small. You will get better, but will not go into remission. We're talking about remission of diabetes, like no medications and
Wow.
normal hemoglobin A1C,
Wow.
which is huge. There's no other treatment to provide this than bariatric surgery.
Right. Interesting. So if someone is recently diagnosed with diabetes who may be overweight, might want to consider,
Absolutely.
or that could be a viable option.
Absolutely, the public doesn't know that.
Yeah, that's
Unfortunately,
interesting.
the wake up call is when the diabetes gets out of control.
Right.
I cannot control my diabetes
Right.
now. I have to take
Medications
insulin.
no longer
Right.
working.
Yeah. Usually that's too late to get rid of diabetes with surgery. It will get better. But if you really want to put diabetes into remission, come to us early.
Oh, interesting.
Yeah.
What else should folks out there, in terms of if they are overweight, they've tried several diets, they failed at diets, what are the guidelines for weight loss surgery? Who would be a candidate for weight loss surgery?
So the current guidelines are a body mass index over 40 or a body mass index between 35 and 40 with another disease like diabetes or sleep apnea or high cholesterol or high blood pressure. It has been recognized now that because of the positive effect that surgery has on diabetes, that we should be offering these
Yeah.
surgeries in people with a lower BMI who have diabetes. So BMI between 30 and 35 with diabetes, and some insurance companies have actually adopted these guidelines. And we're very happy about that because we want to treat diabetes with this surgery.
It could be, well, it's interesting how you're talking about diabetes and coming forward on the onset of maybe perhaps a diagnosis and you are overweight. Could that pose the same kind of outcome for somebody who was just maybe diagnosed with high blood pressure? Like, could that have the same effects in terms of down the road? Maybe they won't need to be on medication. Can that help with that, or is it really just diabetes?
It's the strongest link is with diabetes.
With diabetes, yeah.
Because you have people with normal weight that have high blood pressure.
Right.
So it's a little different model, but we have definitely seen the effect of losing weight on medications for blood pressure. So there's definitely a benefit. But the early interventional surgery with a lower BMI is for diabetes specific.
Right. And for those out there who, like I said, maybe diets have failed and they're a little apprehensive about surgery, weight loss surgery is very safe. I mean, it is surgery, but it is safe, especially the minimally invasive techniques that are available to patients now.
Correct. There's, like I said, there's a lot of misconception about the
Right.
safety of bariatric surgery. People think that the risk is very high. The truth is that these surgeries are very safe. The risk of dying from gastric bypass is 1 in 500. The risk of dying from a sleeve gastrectomy is 1 in 1,000. So very safe surgeries, like a gallbladder surgery. And this is because the surgical societies have established the centers of excellence. So this is a very controlled type of surgery,
Right.
and we do a very good job in providing care. It doesn't mean it's not without risks.
Right. Of
The
course.
risks are there, they're small, and do everything possible to minimize them.
Are the risks greater if you don't have surgery and you have other, like diabetes, or if you have heart conditions? Is the risk greater if you don't have surgery?
Good question.
Yeah.
There are good studies about this, and that show that they compared people with surgery, bariatric surgery, and people who did not. They matched them on weight and comorbid diseases, and they follow them up for 20, 25 years, like in Sweden, where they have a national database. And they show that more people are alive after bariatric surgery.
Wow.
So
Then
it gives people more years of life
Right.
and better years, quality
Better
years.
quality of
Very-
life.
absolutely. Less risk of heart attacks, less risk of cancer, less risk of stroke. Many studies after studies show that bariatric surgery prolongs the life of a person with obesity.
Yeah, incredible. Where do you see, when it's come a long way, surgery has come a long way, and the outcomes, and with all of the research that you're involved in, where do you see weight loss in our society in, say, 10 years? And I know you're a big proponent of reducing the stigma surrounding weight loss, because it is unfortunate how society does view it, and it is a disease. Where do you sort of see all of that in, say, the next 10 years?
It's not going to go away or get better in 10 years. I think maybe a generation, but we'll have to take a step back and see what happened to our society.
Right.
Why is sugar in every single food that is out there, and why is it in bread? Why is in foods that did not used to have sugar before?
Right.
How do we control the food industry as to what they provide to us? Why is healthy food so expensive and difficult to access for people who have financial burdens? So we have to educate our children, our schools, our parents, and our society on what is a healthy diet.
We do have let's see, Elizabeth Bartman has a question. Is there help for someone who failed with lap band? Thanks, Elizabeth, for the question.
Good question, Elizabeth. Yes, the lap band was a very popular surgery a few years back. And the reason for that is that when it came out, it's a technology that is very safe, it's reversible, it has good outcomes. So a lot of people are connected with the lap band. And a lot of our patients had very good results with the lap band. Unfortunately, it's a foreign body. And like any other device that replaces the human body, with time, it may need to come out. So yes, there's a lot of hope with patients with a lap band. We routinely do revisional surgery where we remove the lap band and convert either to a sleeve or gastro bypass with very good results.
Didi Tycho, I hope I'm saying that right. She says, hello, Poppy.
Hello, Didi.
Thanks, Didi. In terms of technology in the future, where do you see that going? A lot of things in the pipeline coming out that are promising for patients?
I believe so, yes. There will be less invasive technologies and treatments and new medications that will help people address this chronic disease with less risk. And I also think that there'll be a better explanation of the variation of the outcomes and better guidelines that are personalized to the specific person we have in front of us. Because if you give the same diet to everybody,
It's not going to
it's not going to work
Right.
well for everybody. So you have to test your genes, your microbiome, your behavior, and prescribe the right treatment for you.
Right. It literally is not a one size fits all.
Exactly.
Really, it's not. And I think, when you hear about diet crazes, the Mediterranean diet and all of that, and people that tout, I've lost 30 pounds from that, well, maybe so, but that might not be right for me. What do you say to sort of all of the diets that are out there? And because it can be overwhelming, and it can also be overwhelming when you're in the supermarket and you're trying to read labels and you're looking at things that are organic, and it can be very overwhelming for people.
Correct. I think you have to start by understanding the labels. You have to know how to read some of the labels because there are a lot of hidden calories in foods. There are a lot of foods that have dense calories. You also have to understand your body. How do you burn calories? And you have to make a decision. Okay, I'm craving this food. This food is, let's say, 600 calories. Can I burn 600 calories? If I can't,
Right.
then maybe I should not be eating this food.
Right.
And there are foods that in a very small amount, you get so many calories and we don't think about it. So we have to educate ourselves on healthy diet, and we have to learn how our body burns calories. And I believe in a balanced diet. I don't believe in very restricted, never eat sugar, never eat a cake, or deprive.
Yeah,
If you're craving a cake, okay,
Carbs.
eat the amount of cake that your body can afford.
right.
If you only burn 100 calories by walking, eat 100 calories worth of cake,
Right.
but not eat like 3 pieces.
Right. Very good advice. What about metabolism as we get older? Does our metabolism change? Does it slow down? How do we deal with metabolism changes, and what causes that?
So this is another huge field of research, and in our team we have Richard Sipe, who's an exercise physiologist. He's a PhD, and that's what he helps us with to understand, how the body burns calories.
Yeah.
It definitely there's a change with after pregnancy. There's a change after an injury, immobilization. The body changes. This is not very well studied, but we know with aging, it's harder to lose calories. I have so many patients who came to me and said, after my second or third child, I could not lose the extra weight that I gained. Or I had like a shoulder or sports injury, and I was immobilized for like a few months, and I gained all this weight back, I cannot lose it. So something changes there, absolutely.
Right. So when your body goes through some type of change, your metabolism changes.
It's
as
at the
well.
set point, your weight
Yeah.
set point goes up.
Yeah.
and then it's hard to bring it back
Harder
down.
to bring it back down.
Absolutely.
Don't we all know that? Dr. Papasavas, thank you so much. This has been enlightening. This has been a great conversation, so we thank
Thank
you
you.
for spending a few minutes with us. And as always, we thank you for joining us. Thank you for your questions, and hope you got something out of this very informative discussion. I'm Hartford Healthcare's Tina Verona. We'll see you soon.
One question? I'm going to send it to you. Ready?
My daughter is 16 with diabetes. Is she available for treatment? Should we respond by typing it in?
We're still, you can just ask, yeah, you can just ask it.
Oh,
I have you up.
okay. We're still up. Antonia has just joined us, Dr. Papasavas. Good thing you did not leave. We have a question. She asks, my daughter is 16 with diabetes. Is she available for treatment? Thanks, Antonia, for the question.
Thank you for the question. It depends on the body mass index. If the body mass index is above 35, then she will qualify for surgery. We're collaborating with the Children's Hospital here in Hartford, and they have a weight loss program. So this could be the place to call, the Connecticut Children's Medical Center.
Yeah, and if you do have additional questions long after this broadcast has ended, we continue to or encourage you to still ask your questions, because we can actually get them over to Dr. Papasavas and respond to your questions. So even if it's long after this broadcast is airing, we'll definitely make sure that we get your question to Dr. Papasavas for an answer. As always, again, thank you for watching. I'm Hartford Healthcare's Tina Verona. We'll see you soon.